This is Dr. Srinivas Jakka, consultant pediatrician and pediatric pulmonologist, Ankura Hospitals, Hyderabad. There is a lot of news about these viral infections in the media today. People are saying that there is a mystery virus circulating in Hyderabad. So I'm here today to discuss these viral infections in children with you and hopefully clarify some of your doubts. So today we are going to discuss why do children get these frequent viral infections, what are the frequent causes of these viral infections, what can parents do at home to treat them, and how to prevent these infections. Firstly, let us discuss why children get these viral infections. Young children until the age of 3-4 years are usually at home. They are not exposed to infections. However, once they start going to childcare, whether it is a daycare, nursery or school, they come in contact with other children who might be carrying these viruses in the form of colds and coughs. So when these children cough or sneeze in their class, all the other children catch these viruses. So parents may be worried that their children are getting frequent colds and coughs every month, or some cases every 2 to 3 weeks as well. Sometimes these children carry home these infections and may affect other family members, especially younger siblings, and they too might be catching frequent colds and coughs. So these infections are usually carried by air and less commonly by contact from one person to another. So sometimes these infections may be overlapping very close together, so that for parents it might appear that their children is always suffering from cold and cough continuously. So what are the common viruses which children get? The viruses depend on the season to an extent. Usually summer children don't get much viral infections, but once rainy season starts, then they start with dengue fever, and this also followed by other respiratory infections like influenza or flu virus, adenovirus, which we saw a few months ago, and now we are seeing a respiratory syncytial virus or RSV. In addition to this, there are also other viruses like rhinovirus, a parainfluenza virus, human metapneumovirus, etc. So what are the symptoms of these viral infections? The symptoms depend on the body part affected and number 2, the severity of infections. For example, if the infection affects your nose, they may have runny nose, blocked nose, mouth breathing, etc. If the infection affects the throat, they may have pharyngitis, tonsillitis and inflammation of your adenoids, where they may have difficulty in swallowing, snoring, mouth breathing, etc. If the infection goes down to the level of your voice box and vocal cords, they may have what we call croup, where the voice becomes hoarse, and they may have what we call a barking cough. And unfortunately, if the infection spreads lower down to the lungs, in some children the airways become tight, and then the children will have wheeze and breathlessness or worsening of their asthma. In other children, it might cause a viral pneumonia, where the infection involves the lungs tissue, and in these children they have worsening of cough, high temperatures, they may have breathlessness. Parents can recognize breathlessness by fast breathing and heavy breathing, where they may see indrawing of the chest and also the rib cage. So these symptoms involve different parts of the respiratory system. Sometimes the symptoms may affect other parts of the body. For example, if they infect the eyes, then you may see conjunctivitis or red eye. If the infection involves your gastrointestinal tract or the abdomen, they may see nausea or vomiting sensation, vomitings, loose stools, or both. And in addition to these viral infections, they may have generalized symptoms like fever, body pains, muscle pains, joint pains, nausea, vomiting sensation, loss of appetite, vomitings, etc.